Welcome to this explainer. Today, we're diving straight into the hidden and honestly fascinating mechanics of how our heart valves function and ultimately how they fail. If you've ever wondered exactly what goes wrong when someone is diagnosed with heart valve disease, well, you are in the perfect place. We're going to break down all these complex medical concepts into clear, highly visual terms that make sense, especially if you're just starting to explore this topic. So, here's our roadmap for this explainer. We're starting with the absolute basic mechanics of valve failure. Then we'll look at abnormalities in both the aortic and mitral valves, take a quick peek at the right side of the heart, and uncover how infections like rheumatic fever cause real damage. And finally, we'll check out the incredible modern engineering we use to fix these broken valves. Okay, let's jump right in. Take a look at this staggering number, 30 million to 40 million. That's the number of times your heart valves contract and endure intense tissue deformations every single year. I mean, the mechanical stress they are under is just immense. With literally every heartbeat, these delicate little structures have to snap shut tightly against high pressures and then swing wide open again. Over decades, that relentless mechanical punishment really takes a toll. Section 1. The mechanics of valve failure. To really wrap our heads around what goes wrong here, it helps to just think of your heart as a plumbing system and the valves as simple one-way doors. Basically, all valve disease simplifies into two core mechanical failures. On the left, you've got stenosis. Think of this as a stiff, rusted door that just refuses to open all the way. It forces the heart to push incredibly hard to squeeze blood through a narrowed gap. Then, on the right, we have regurgitation, which is also called insufficiency. This is a door that swings shut but doesn't quite lock, allowing blood to leak backwards. Both of these scenarios make your heart work much, much harder than it's supposed to. And that brings us to a very specific type of failure, known as prolapse. Imagine that one-way door we just talked about completely losing its structural integrity. So instead of holding firm against the pressure, the leaflets become floppy and actually balloon backwards or prolapse into the previous chamber. It's a structural bending that often leads directly to that backward leak or regurgitation we just defined. Section 2. Aortic valve abnormalities. Let's apply these mechanics to a specific door, the aortic valve. This is a real heavyweight on the high-pressure left side of the heart. Look at the intense, stony calcification visible here. Remember those 30 to 40 million beats a year? Well, over time, that repetitive stress can cause actual, bone-like calcium deposits to heap up on the valve tissue. It effectively cements the door shut, leading to severe stenosis. In fact, the valve opening can shrink from the size of a quarter all the way down to the size of a pencil eraser. When the heart struggles to push blood through that tiny, calcified opening, we see a classic triad of symptoms: shortness of breath when you exert yourself, chest pain, which is angina, and fainting, or syncope. And if you think about it, that makes perfect sense, right? The engine of the heart is revving harder and harder against a blocked exit, which means the rest of the body and even the heart muscle itself is being starved of the oxygen-rich blood it desperately needs. Now, the absolutely crucial takeaway here is that wear and tear happens to everyone, but it happens a lot faster if your plumbing has a structural defect from birth. About 1% of the population is born with a congenitally bicuspid aortic valve. Instead of 3 beautifully interlocking flaps, or cusps, they only have 2. Because fewer flaps are sharing that massive load, the mechanical stress is way higher, and that stony calcification process we just saw, it gets drastically accelerated. These patients often develop symptoms decades earlier than someone with a normal 3-cusp valve. Section 3. Mitral valve abnormalities. Let's transition over to the other major valve on the left side of the heart, the mitral valve. This one faces an entirely different set of mechanical challenges. Notice the tight, normal mitral valve architecture on one side, compared with the one suffering from what's called myxomatosis degeneration. Do you see that pronounced hooding and the thick, almost rubbery look of the valve on the right? The structural connective tissue has completely broken down. It is the ultimate floppy door, billowing back into the atrium with every single heartbeat. Now, it's pretty important to note that this floppy door is actually incredibly common. It affects up to 5% of people, and in most cases, it's completely harmless and has no symptoms at all. However, in a small minority of cases, it can cause severe regurgitation, where a significant amount of blood flows backwards. Plus, the friction of this floppy valve snapping back and forth can damage the heart's lining. That puts patients at risk for arrhythmias, dangerous infections, or even a stroke if tiny blood clots happen to form on the damaged tissue. Section 4. Right heart valve disease. So far, we've focused heavily on the left side of the heart, which is responsible for pumping blood to the whole body. But what about the right side, which pumps blood just to the lungs? The right side contains the tricuspid and pulmonary valves. Because they deal with much lower pressures, they're generally spared from that age-related stony calcification we talked about earlier. When they do fail, it's typically for different reasons. Pulmonary stenosis, for instance, is usually congenital, meaning you're born with it. Tricuspid regurgitation often happens just because the heart chamber itself stretches out, which physically pulls the door's hinges apart. Or, unfortunately, it can be due to infections introduced directly into the bloodstream, very often via IV drug use. Section 5, Infections and Rheumatic Fever. Okay, shifting our focus from physical wear and tear to microscopic invaders. If you look at both the mitral and aortic valves across both stenosis and regurgitation, two major repeat offenders pop up time and time again: calcification, which we've covered, and rheumatic heart disease. But what exactly is rheumatic heart disease, and how on earth does it destroy these valves?
Well, it all starts with rheumatic fever. And honestly, here is an absolutely mind-blowing medical fact. A simple, untreated case of childhood strep throat, specifically group A streptococcus, can actually destroy your heart valves. It doesn't happen because the bacteria eat the heart or anything like that. It happens because your own immune system gets deeply confused. Weeks after the sore throat is gone, the antibodies your body built to fight the strep mistakenly cross-react with the proteins in your own heart valves, launching this massive, misguided inflammatory attack.
And this image right here shows exactly what that inflammatory attack looks like on the valve itself. See those tiny, warty bumps along the edges where the valve is supposed to close tightly? Those are called verruca, and they completely disrupt that tight seal. Over decades, this acute inflammation turns into chronic, thick scarring. The valve leaflets become fused together and heavily deformed. What literally started as a standard sore throat ends up permanently destroying the mechanics of the heart stores. And rheumatic fever isn't the only biological threat out there. There are 4 distinct diseases that leave distinct clumps or vegetations on the valves. On the far left, you've got the small, warty bumps of rheumatic heart disease we just looked at. Next to it, the massive, bulky, highly destructive vegetations of infective endocarditis. That's caused by aggressive bacteria like staph or strep directly infecting the valve. Then we have smaller, sterile clots seen in debilitating illnesses, and finally, vegetations caused by autoimmune diseases like lupus. While the causes vary wildly, the end result is always exactly the same: the mechanical destruction of the valve. Section 6. Fixing broken valves. So what happens when the heart's plumbing is critically compromised? How does modern medicine step in when these doors simply cannot function anymore? Well, the clinical approach follows a very logical progression. First up, we try medical therapy. Now, we obviously can't fix a mechanical problem with a pill, but we can manage the symptoms, using diuretics to pull excess fluid out of the lungs or anticoagulants to stop blood clots from forming. But eventually, a broken door needs a structural fix. Step 2 is valve repair, where surgeons go in and try to mend the patient's native valve, often by cutting out that floppy tissue we saw earlier. If it's too far gone, though, we move to Step 3, full valve replacement. And let me tell you, the engineering behind valve replacement is nothing short of miraculous. Just look at this device. This is a transcatheter aortic valve implantation, or TAVI. For patients who are just too frail for open heart surgery, doctors can take a brand new biological valve, often made from animal tissue, mount it inside a collapsible metal stent, fold the whole thing up into a tiny catheter, and navigate it all the way from an artery in the groin right up into the beating heart. Once it's inside the old calcified valve, they blow up a balloon, expanding the new stent, which just forcefully pushes the old broken door out of the way and takes over immediately. It is breathtaking technology. Yet, as much as we can map out the plumbing and engineer these brilliant mechanical fixes, the human heart remains profoundly complex. As our source material beautifully points out, as physicians, we often focus on explainable physical aspects of disease, but the physical and psychosocial are inconveniently related. We are so much more than just a network of pipes and valves. Which leaves us with this final thought. There is actually a condition known as Takotsubo cardiomyopathy, literally broken heart syndrome, where extreme emotional distress triggers a massive surge of adrenaline that actually alters the physical shape and pumping ability of the heart. The mechanics break down, not from wear and tear or bacteria, but from pure psychological pain. So, while we have absolutely mastered how to replace the doors of the heart, the deepest mysteries of how our emotions physically shape our core remain. We can fix the plumbing, but what becomes of a truly broken heart? I hope this explainer has given you a whole new appreciation for the incredible, tireless engine inside your chest. Keep learning, and I'll see you next time.